What if there was a way for people with certain heart conditions to avoid having to take blood thinners for the rest of their lives? Would they? Well, the University of Louisville doctor is one of the first in Kentucky to offer a new implant to some patients with atrial fibrillation. Dr. Rakesh Gopinathannair, did I get it right?
Yep.
Or close, is here to talk about this innovative surgery. Well, Dr. Gopinathannair, I got it right the second time, right? Welcome to the show.
Thank you, Mark.
All right, well, let's talk about, first of all, what is AF? What is atrial fibrillation? What is that for those of us who don't know what it is?
Atrial fibrillation is a heart rhythm disorder where the upper chambers of the heart go into sort of a chaotic, irregular rhythm. And when it happens, there are a couple of things that will happen. One, your heart rate tends to go too fast. Number two, that upper chambers stop pumping very well. So it kind of like a bag of worms kind of thing. So what happens is the blood gets pooled in those upper chambers, and if it goes unrecognized, it can result in blood clots forming in those upper chambers, and those blood clots can get dislodged and go to your brain and or anywhere somewhere else in the body, can cause stroke, or get your blood vessel of the leg blocked up. But stroke is a major issue with atrial fibrillation, and there are certain people with associated heart conditions, high blood pressure, diabetes, older age. They are at a higher risk of developing stroke from atrial fibrillation than somebody with like 30 years old, basically.
Right. Well, is this similar to what some athletes have had in the past, where they went undetected, they got a blood clot, and then died, like Len Bias and some of those other folks? Is that similar or not?
It's a little different. The clots that form in the lung are due to blood clots that already form in the veins in the leg. And they go up into the lungs. Atrial fibrillation can happen in certain athletes, especially high endurance athletes like marathoners and stuff like that. But in those people, they are not as dangerous as those, in the older age group, or have associated what we call as comorbidities in that regard.
And so the folks who have AF, and they find out they have AF, they normally, in the past, took blood thinners. Why? What does that do to help their condition?
So basically, the biggest, as I mentioned, the biggest risk is having a major stroke. Atrial fibrillation is responsible for 20% of all strokes in this country. And Kentucky, especially, is really high in terms of atrial fibrillation incidence, and one of the top in the country. I mean, it's not something to be bragged about, but still, it's a concern. And so when, if in order to prevent strokes, we have blood thinners have been the the best case scenario for a long time. And basically, the blood thinners thin the blood. It doesn't necessarily do anything to prevent atrial fibrillation, but it just prevents strokes from atrial fibrillation. And in somebody who has a high risk of blood clots forming, the blood thinners reduce that risk substantially. But on the other hand, the blood can be associated with bleeding issues, and there are some people may not even be able to take blood thinners.
Gotcha. So that's why you come up with this alternative idea, right?
Correct. So the rationale behind this is called, there is a outpouching of the left upper chamber of the heart called the appendage. It's kind of like just a pouch that hangs out.
Okay.
And that is where 90+% of all the blood clots tend to form. So the idea behind this, what we call as that particular outpouching, is called the left atrial appendage, or we can simply call it appendage. So closing that appendage can actually prevent blood clots from getting out of the appendage. It may still form there, but it cannot get out.
Go to someplace else in your body, into your brain or someplace else, and cause you to die.
Absolutely.
Okay.
And so this particular device that we have called the Watchman device, it's kind of a small umbrella-like device that you place it on the mouth of the appendage. It is done through your vein in your groin, and there's no incision involved or anything like it. It's not like big surgery. And you can place it at the top on the mouth of the appendage, and it has some tiny barbs and wires that keep it in place. And after time, the body kind of seals over it and completely closing that appendage. So, in patients who get this can come off of their blood thinners in a few weeks, and completely off of, vast majority comes off at about 3 months or so, and then they don't need to take it for the rest of their lives.
Right. We're talking with Dr. Rakesh Gopinathannair from the University of Louisville, who is doing they're implants basically,
Correct.
right?
Mm-hmm.
They're implants at Jewish Hospital.
Correct.
So what can you tell us about the number of folks and the types of folks who might be eligible to have this implant, and those that have AF and are not?
So typically, I'll talk about the indications first. Basically, these are patients who have atrial fibrillation and are need blood thinners or anticoagulation for their atrial fibrillation, but have some sort of a relative contraindication or rationale to seek an alternative therapy. Some people take blood thinners for whatever they're happy about, but others cannot. It's like if you have a bleeding from your gut or somewhere else, you're higher risk for falls, you're on an additional blood thinner for like a stent or something like that.
Right.
Or you have enough comorbidities like kidney disease, liver disease, all those kind of stuff.
You got some other problems.
Correct, yeah. And long-term blood thinning becomes a big problem. But these may be patients who may be able to take blood thinners on the short term, but they cannot take it for more than, forever, basically. So these are great candidates for, this particular implant. And if you can get them through that first few weeks of blood thinners after the procedure, then they are free to be off of blood thinners. And this particular device, Watchman, has been compared against the most commonly used blood thinner, warfarin, in several studies, and have shown to be equally efficacious, if not a little better, in many parameters.
So it works just as well as drugs.
Absolutely.
And keeping people with AF from having blood clots developing.
In the available studies, yes.
Okay. How many folks are we talking about here? Is this a very small pool of people that we're talking about, or are we talking about a lot of people in the Louisville area who might be eligible for this surgery?
Excellent question. I think there is a lot of people. So if you look at Louisville, I mean, the last numbers that I have, there are about 60,000 plus hospital admissions every year for atrial fibrillation. So,
wow.
And many of these patients require blood thinners, basically. And as people get more, like just to give an example, 10% of patients above the age of 80 have atrial fibrillation, general population, and a lot of them need atrial fibrillation. So we are looking at a big pool of patients. About 7 to 8 million people in the United States have atrial fibrillation. So so I think as you get older or have other illnesses, there's a risk of bleeding and all those kind of things. So I think we expect as the procedure, more and more data comes in, I think more and more people we can avoid long-term blood thinners with this procedure.
And this is a relatively new surgery and implant, is it not?
Correct. Yeah, it was approved by the FDA last fall and by CMS earlier this year, and it's really it's a recently done procedure. From a technical standpoint, it takes approximately an hour or so to do the procedure with the patient under sedation, and they usually stay overnight in the hospital, and they can go home the next day.
And that's it. Mm-hmm. So it's not like
no.
or you're doing anything major with the heart or anything directly, correct?
Yeah, we kind of go, it's a minimally invasive, done through, just like a heart cath kind of procedure, done through the groin, and we go through your veins, essentially, into the heart chambers.
And for people who are listening to this and say, oh, well, either I've got AF or my husband or wife has AF, and this might be something for them, how should they get a hold of you and track you down and say, hey, I might be... that surgery might be good for me. I might want that implant.
We have a program at the Jewish Hospital, and we have a number we can reach to, and it's also advertised at the website for both UofL as well as in Kentucky one, which is Jewish Hospital. I can't remember the number right at the top of my head, but I'd be happy
people
to.
Won't remember the number anyways. But if we go to either Jewish Hospital's webpage or the University of Louisville, School of Medicine,
correct,
would it be in there?
Mm-hmm.
And I guess I could spell your name, but it begins with G, ends in R. But if people will, if people are interested and they want to contact
absolutely.
me,
my office number is in there, and we'll be happy to discuss with them,
right.
And we do test their eligibility for
right.
this.
I'm sure if you call Jewish Hospital or the University of Louisville School of Medicine and ask and say, hey, who's the guy that's doing that AF surgery? They'll be able to track you down, right?
Absolutely.
Okay. All right. Dr. Rakesh Gopinathannair, thank you very much for being on the show with us today. Good luck with the surgeries.